Protesters gathered in front of Representative Barrett's Lansing office today to voice their disappointment in his vote.
Particularly how he supported the legislation's cuts to Medicaid. Our Rachel Ramsey was there. She is here for you now tonight with more on their concerns.
Yeah, Siobhan, Jorma, this protest was originally scheduled to ask Rep. Barrett to please vote no on the, quote, one big beautiful bill. But since he voted yes overnight, people are reacting. The proposed changes still need to get through the Senate, but in the meantime, these protesters say they are worried about the bigger implications.
Shame on Barrett! Shame on Barrett!
It is important to provide mental health and health care. It is all a right. It's not a privilege.
Protesters are asking the federal government to keep its hands off of health care. Greta DeWolf says Medicaid was crucial for her while she was a single mother pursuing a college degree.
Some bad things happened to me. I got on welfare, and Medicaid was fundamental in providing that health care to give me a leg up as well as my children.
Governor Gretchen Whitmer says cuts to the program could terminate more than 700,000 Michiganders' health care. But U.S. Representative Tom Barrett says the cuts would, quote, strengthen Medicaid's integrity by preserving it for the people who need it most. Protesters in front of his office say lawmakers who voted yes aren't looking at the bigger picture.
Even people who are not on Medicare or Medicaid are going to be affected.
Carol Clyde says through her 26 years working in healthcare, she has seen how much hospitals rely on Medicaid.
Even larger hospital systems are going to have to cut back because they won't have the income they've had before. What are you cutting health care for?
Rep. Barrett says the cuts would remove recipients who are ineligible from the program, and for some recipients there would be a requirement to work or volunteer for at least 80 hours a month to qualify for the program. This would have to be verified twice a year.
There are some people that are unable to work. What are we going to do with that?
There are some exceptions for this requirement, but either way, these protesters say there should not be extra hoops to jump through when it comes to receiving health care.
There's nothing beautiful about this bill. Not one single thing.
If the bill passes, it would take effect in 2029, and the $880 billion in proposed cuts to energy and healthcare programs would happen over the course of 10 years. Back to you.